Hi, it's Dr. Betzing with Justice Dental. I'm going to talk today about sleep studies. And so that's something that we've recently brought into our office due to a number of our patients complaining that they just hated going to a clinic and doing a sleep study. It was uncomfortable, they felt awkward. And so we were able to find a company that makes an actual at-home sleep monitor. So it's a monitor that you can take home with you. You can sleep in the comforts of your own bed, and you'll sleep all night. You'll turn the monitor in the next day, and then we actually take that monitor, download a report, send it to an actual sleep physician, and we get all the details. And one extra thing that our monitor does that they don't do at the sleep clinics is we can measure if you're doing any bruxing or clenching at night. And that's really important because even if you were to need a CPAP or a sleep appliance, it doesn't always cover bruxing and clenching, and that's one of the main things that a lot of patients do when they have sleep apnea. So our little monitor here, as you can see, this is what you'll wear at night. It fastens to your chest here, and you'll have a few wires that connect to your jaw and to your nose and a couple to your finger, and that's it. We've had several patients take it home, and they've said they slept like a baby, and it was so nice being at home. So we've recently had a patient come in that actually had a sleep study done, and she had complained for a long time that she wasn't getting any sleep. She was really uncomfortable at night, so her physician had recommended her going to an actual sleep clinic. She went to that clinic and came back to us with the report, and it said that she had mild to moderate sleep apnea. And so she said that her doctor had prescribed a CPAP, and she said no way was she wearing a CPAP. She didn't like the way they looked cumbersome, and she just felt like they were gross. So we said, let's take a look at the report, and then we'll determine if there's something that we can do with a sleep appliance. And so we looked at her, and we came up with an appliance for her, and we ordered it, and she took it home, and several days later she came back and said that that was the most sleep that she's had in probably about 10 years. And she was sleeping like a baby, and she was so happy. She said she was very apprehensive at first because she didn't think there was no way that a little appliance that snaps on her teeth is going to help her sleep better. But she was pretty happy that it did work out for her. And this is something that we can do for a majority of our patients. You know, if you feel that you're sleepy during the day, your partner complains of you snoring and they're not getting any sleep, if you notice that you wake up in the mornings and your jaws are sore and tender and you're just really lethargic and kind of have just a cloudy feeling all day, that's something we could definitely help you with. So if you click down below, you can get started with some information, and we can guide you on the next process.